this episode of DPR Insider. Today we are discussing the remarkable advancements in CAD/CAM technology, particularly how CAD/CAM is affecting the entire restorative workflow from practice to lab to patient. Our guests today are Dr. Brian Couch, a Coppell, Texas general dentist who uses the PlanScan E4D CAD/CAM system, Sherry White, an RDA and CAD/CAM trainer who teaches dental teams how to integrate and get the most from their CAD/CAM systems, and Jimmy Fincher, a lab owner and digital dentistry trainer, also from Texas. So everyone just give a quick hi.
Hello. Hello. Hello.
All right. Dr. Couch, let's start with you. I think when most dentists hear the term CAD/CAM, they automatically think of in-office milling, doing the whole process kind of all or nothing approach. But in reality, the tools we have now, especially with open architecture systems like PlanScan, mean practices can incorporate digital scanning at various levels. Dr. Couch, what has your experience been with this?
Mine's been pretty exciting from the time that I started. I've had it almost 5 years. I've looked at the systems for some time and chose, which is now PlanScan for my office. I started off with in-office milling. So a lot of the things that we're seeing now, I'm already kind of accustomed to, and welcome even the expansion of the technology. But and the ability to work with the laboratory, and Sherry will speak for dental assistants, but you definitely want to let them be a part of this whole process. But I'm glad I started off really with the in-office milling process, because I think most dentists will end up incorporating in-office milling at some point in time, even though they may want to start at scan-only process.
Mm-hmm. Dr. Couch, you mentioned assistants. So Sherry, let's go to you. You train practices on how to integrate successful digital workflows. How do you see the most successful teams working together in this digital environment?
I think the biggest thing is they're afraid of technology, and sometimes they're just a little afraid to embrace it and to take on a new responsibility. But what I find is most assistants willing and able, and they all are. Once they embrace the technology, they find that it definitely empowers them and helps them be part of the process. And just the team utilization and acceptance is amazing. It definitely empowers them. They feel like they're part of the process, and they're happier.
Okay. Dr. Couch, how does that work in your practice? Could you take us through a typical case?
You know, it works very well. In fact, Sherry, I remember when I was examining CAD/CAM, would always say, delegate and celebrate. And I agree with her. It took me a while to kind of comprehend it while I was training in our office as well. But the more the dentist can incorporate auxiliary to help them in this process, it allows them really to treat the patients better. And ultimately, you want the highest quality product and improve the patient service and experience. And that's what CAD/CAM in-office milling does. Now, it does not eliminate the laboratory technician, and I can't wait till you talk to Jimmy, because you know, there's some things that may actually be a little more difficult for offices until they get capable of doing it. So it really has empowered the whole dental team, and actually the technology's brought us all together to be able to work more closely to be able to deliver a better product for the patient.
Okay. Well, Jimmy, I definitely want to hear from you. Your side is fascinating to me. So what has this digital change, how has it affected the way dentist and lab work together? And if you could explain what it's like when a dentist provides a digital scan. What is it like? What happens?
Sure. Well, first off, what it's changed is it's kind of taken us to a whole different level of communication. We're able to talk about and do things that we weren't doing before. So, you know, as Brian was saying, we do a lot of things like that together. And when we get a scan in from the doctor, it's kind of like whatever you want to do is what we can do. So we don't really have any limitations with them anymore. We're taking the scans and doing as little as designing the scans and sending them back to the doctor so they can mill out in their own office if they choose. We're taking the scans and designing and milling for them. We're taking the scans and we're having models created from that by exporting them and importing them into other systems. So really, from A to Z, it's really kind of changed all the options, and we can do pretty much anything we want to do. That's kind of what's exciting is, it's whatever level the dentist wants to do, and we have the ability to shoot these files back and forth to each other. So we're communicating without having to fabricate a case, send it to the doctor to have them look at it and see if they like it. Now you just design it, shoot it right back to them, and they can either make changes or tell you what they want to change, or we all decide we like it and move forward with the case. So very exciting.
Just from a time-saving standpoint, I mean, what are we looking at?
Whereas say if we were going to do, I don't know, say a 12-unit diagnostic for someone, now a doctor can just scan that, and instead of taking about a week to get the impressions for the models, duplicate them, mount them, hand wax them, and then ship that back out to the doctor, now I can take those scans and probably within about 30 minutes have something for him to look at.
Okay. Sherry, you mentioned that often when a practice is first getting involved in digital, that there's a little bit of trepidation, maybe some fear of the technology. How long have you found it takes to get comfortable?
I found most successfully practices that embrace it. After about doing 20 restorations, they're feeling pretty comfortable and confident. Everybody's learning curve can be a little bit different, but the most successful offices with it that really want to embrace the technology, after about 20 restorations, I find they're pretty proficient.
Okay. Dr. Couch, was that your experience?
It is. I think maybe for some of the older folks like me, it was something that would be a lot harder. But my assistants, might be more in their 20s and 30s. They pick it up right away. I did want to piggyback off of something that Jimmy said, and I just want you to know that not only can you take this technology, but if Jimmy wanted to show me a case that he was working on, he could sit and do a screen grab and send it to my email on my phone, no matter where I'm at, and we can discuss it. So you really save a lot of the waiting time in between. The technology is just so useful for communication purposes that, like he said, it may take him longer in the lab to pour something up. He can show it to me within maybe 30 minutes. If I'm not in the office, he can send it to me personally. I can look at it, write anything I want to back to him, and we've actually probably saved a week or two just in that 5 or 10 minute process.
Remarkable. That must be an amazing experience for the patient.
Definitely, it's a wow factor. Patients that have a same-day crown will settle for anything less.
Dr. Couch, when we spoke before, you were. I was really impressed with the level of importance that you put on the impact that CAD/CAM has had on your practice. Wondering if you could tell me a little more about that.
Well, when I first started examining adding CAD/CAM to my practice, the main thing that I was trying to do was maybe control laboratory expenses. And I would say that what I learned was the number one reason I should have been looking at it was really more patient experience. And that took me just watching the patient go through the process and hearing them time after time saying, "You mean you don't have to put that goop in my mouth?" And I think we discussed that on the phone the other day. They don't like that stuff in their mouth. So just the process of digital scanning alone is an improvement for creating a wow experience for the patient. The high quality restoration is without question. And if then I get to a case that is more difficult, that requires a laboratory technician who does this day in and day out, then by all means I'm scanning and sending that to Jimmy, the cosmetic advantage. So what I would really focus on if I were really investigating CAD/CAM was not necessarily what it saves in laboratory expenses. I would be telling the doctors you need to be doing it because it improves patient experience. And like Sherry had said earlier, once they have a crown done same day, they do not want to do it any other way. They'll wait if they have to because they want it done the same day.
It's just like glasses. If you lost your glasses, would you go somewhere that you're going to have to wait 2 weeks to get them, or are you going to go somewhere that can deliver them in a minute? Really?
Well, I actually can speak from the patient perspective because I had my first crown, my first CAD CAM crown done just about 2 months ago, and it was with a plan scan system. And yes, it was remarkable. I having impressions done is my absolute least favorite part of going to the dentist. I'd rather have a mouthful of injections than have to sit there for 2 minutes with that in my mouth. So for me, it was great.
I would say most people share that same experience.
Mm-hmm.
We hear it day in and day out using CAD CAM that the patient just goes, "You mean I don't have to do that? I don't have to come back?" And not only are they impressed, but they do tell their friends, their coworkers. If they're sitting there waiting while it's milling out, they're usually emailing, texting, or calling someone, and it just saves them from having to take off multiple times from work or home activities because they're completely done. It just is phenomenal what it does for the patient.
Fantastic. Jimmy, I know on the lab side as well, I've heard over the years as CAD/CAM has grown both in office and on the lab side, I don't think it's always been an exciting news for folks in the lab industry. I think there's been a lot of fear on that side as well. How is it playing out in reality for the lab industry? Where do you see things going? And what's your message for not only your fellows in the laboratory industry, but to your dentists?
Yeah, I see it kind of playing out, where, yeah, there's a lot of fear. A lot of people, especially lab guys, we're very resistant to things that we feel like are going to take work out of our hands and allow the dentist to kind of circumvent, using us. So we get a little nervous about that. But I've kind of found that ultimately, because so many dentists are, the more and more they're starting to use it, the more and more stuff we're actually doing with them because of it. And so that's really made a nice change because while with a doctor like Dr. Couch, that I may not see all of this awesome work and some of the stuff that he's doing in house, we're doing a lot more together than we ever used to with some of these larger companies. And so I see the industry, it's trending that way anyway. The doctors are going to buy these things. These scanners are good. And as lab technicians, we need to understand that we have to embrace that technology and figure out how it's going to work for the lab. And like I say, it's increased the relationship that I have with several doctors. And we talk all the time. We're doing larger cases together that we may not have done together. And we're trying new things. And so I think it's going to keep going this direction. I think that more and more doctors are going to not only buy complete systems, but just digital scanners. And I think the labs that have made the move and decided to invest in that and be able to service those dentists, it's going to open so many more doors than what I think it ever closed.
Collaboration can only help, and I love to see this team approach to patient care with the lab right there by the side. Dr. Couch, any final messages for our viewers?
Well, I'd like to say something about what Jimmy said on it improves collaboration. Usually specialists, dental specialists, get concerned when any general dentist maybe does something that's in their field of expertise because they feel like, well, that's something that they should do. The times change. So the laboratories that don't embrace this technology aren't going to be around. And that's why I think it's remarkable what Jimmy has done. Now, he has an expertise that I'm going to continue to use because it's in the patient's best interest. So he said it, and I want to echo it. There's maybe some of the larger cases that I think that need that expertise that he has. I want him to do because that's what he does for a living, and he makes me look better by adding that expertise, and the patient being satisfied helps in the long run. So some of the little small things, like if I were to choose to place implant, I may not send every particular one to the surgeon who's going to place it. They can worry about the one or two little ones I do, or they can cultivate with the technology and the relationship that I'll be sending them the larger things that are beyond my capability. So it just depends on how you want to look at it. I can't imagine any restorative dentist today not having an in-office milling CAD/CAM system.
Sherry, any final thoughts?
I just tell the assistants to embrace it. I tell them all the time out in the field, the bus is here. We have the opportunity to get on board or wait for the next ride. And I tell them to get on board now. The time is right.
Okay. And Jimmy?
All I can really do is kind of echo what they're saying, because it's true. You know, this technology is so good that the labs that won't embrace it are the guys who are shutting down. And there's no way, if you don't evolve with this, that you can survive. And I think it's going to bring up the quality of laboratories as well as the laboratory technicians. And so I say you can embrace it and move forward.
Okay. Well, thank you all for being with us today. I know for myself, as a patient, it was a great experience, and as a journalist in the dental field for about 20 years now, I have to say this is the most exciting time, the most exciting advancement I've seen. It's been a thrill watching this technology develop, working with companies like PlanScan to just keep educating our market even better. If you would like to learn more about how the digital workflow can fit into your practice at various levels, please download our brand new white paper. You'll find the link in the article attached to this video. It is about 18 pages of deep information that tells the whole story from the practice to the lab to the patient, and certainly goes deeper on everything that we heard here today. So thank you for tuning in, and we'll talk to you next time.